Welcome to today's educational video, where we'll be exploring colonic polyps, growths that develop on the inner lining of the colon or rectum. We'll delve into what causes them, how they affect your body, and what can be done to treat and prevent them. The exact cause of colonic polyps is not fully understood, but several factors are believed to play a role. Genetic mutations, either inherited or acquired over time, can disrupt the normal cell growth and division process in the colon lining. These mutations can lead to uncontrolled cell proliferation and the formation of polyps. Lifestyle factors also contribute significantly. A diet high in red and processed meats, saturated fat, and low in fiber is associated with an increased risk. Smoking and excessive alcohol consumption are also implicated. Furthermore, inflammatory bowel diseases like ulcerative colitis and Crohn's disease can increase the risk due to chronic inflammation in the colon. At a cellular level, the development of colonic polyps begins with mutations in genes that control cell growth and differentiation. These mutations can affect various signaling pathways within the cells of the colon lining. For example, mutations in the APC gene are frequently found in adenomatous polyps, a common type of polyp that has a higher risk of becoming cancerous. As these mutated cells divide and multiply, they form a small growth, the polyp. The polyp initially grows slowly, but over time, it can increase in size and potentially undergo further mutations that increase its risk of transforming into colorectal cancer. The larger the polyp, and the more abnormal its cells appear under a microscope, the higher the risk of malignancy. Colonic polyps are a common condition, with prevalence increasing with age. Studies suggest that approximately 20–30% of adults in Western countries will develop colonic polyps during their lifetime. The risk is higher in individuals over the age of 50. Men are slightly more likely to develop polyps than women. Individuals with a family history of colonic polyps or colorectal cancer have a significantly increased risk. Certain ethnic groups, such as African Americans, also have a higher incidence of colorectal cancer and, consequently, may have a higher prevalence of colonic polyps. Many people with colonic polyps experience no symptoms at all, especially when the polyps are small. However, larger polyps can cause several signs and symptoms. These may include rectal bleeding, which can appear as blood in the stool or on toilet paper. A change in bowel habits, such as diarrhea or constipation lasting longer than a week, can also occur. In some cases, polyps can cause abdominal pain or cramping. Iron deficiency anemia, due to chronic blood loss from the polyps, may lead to fatigue and weakness. It's important to note that these symptoms can also be indicative of other conditions, so it's crucial to consult a doctor for a proper diagnosis. The gold standard for diagnosing colonic polyps is a colonoscopy. During a colonoscopy, a long, flexible tube with a camera attached is inserted into the rectum and advanced through the colon. This allows the doctor to visualize the entire colon lining and identify any polyps that may be present. If polyps are found, they can be removed during the colonoscopy in a procedure called a polypectomy. The removed polyps are then sent to a laboratory for pathological examination to determine their type and whether they contain any cancerous cells. Other diagnostic tests include flexible sigmoidoscopy, which examines only the lower portion of the colon, and stool-based tests, such as the fecal occult blood test SOB-T and the fecal immunochemical test FIT, which detect blood in the stool, a potential sign of polyps or cancer. Virtual colonoscopy, or CT colonography, is a non-invasive imaging technique that can also be used to detect polyps. Colonic polyps can be classified into several types based on their microscopic appearance and their potential for becoming cancerous. Adenomatous polyps are the most common type and are considered precancerous. They are further classified into tubular villous and tubulovillous adenomas, based on their shape and structure. Villous adenomas have the highest risk of becoming cancerous. Hyperplastic polyps are generally considered to be benign and have a very low risk of becoming cancerous, although large hyperplastic polyps in the right colon may require closer monitoring. Serrated polyps are another type of polyp that can have varying degrees of risk. Sessile serrated adenomas, in particular, have a significant potential for becoming cancerous. Inflammatory polyps, also known as pseudopolyps, are often seen in individuals with inflammatory bowel disease and are not considered precancerous. The primary treatment for colonic polyps is removal, typically performed during a colonoscopy through a polypectomy. Small polyps can be removed with a snare, a wire loop that encircles the polyp and cauterizes it off. Larger polyps may require more advanced techniques, such as endoscopic mucosal resections (EMR) or endoscopic submucosal dissection at ESD, which involve lifting polyp away from the colon wall before removing it. In rare cases, if a polyp is too large or cannot be removed endoscopically, surgery may be necessary to remove the affected segment of the colon. After polyp removal, Regular follow-up colonoscopies are essential to monitor for any recurrence of polyps and to screen for new polyps. Several strategies can help prevent the formation of colonic polyps. Adopting a healthy lifestyle is crucial. This includes eating a diet rich in fruits, vegetables, and whole grains and low in red and processed meats and saturated fat. Maintaining a healthy weight, engaging in regular physical activity, and avoiding smoking and excessive alcohol consumption are also important. For individuals with a family history of colonic polyps or colorectal cancer, genetic testing may be recommended to identify any inherited genetic mutations that increase their risk. Regular screening colonoscopies, starting at age 45, are highly effective in detecting and removing polyps before they can become cancerous. Discuss with your doctor about the appropriate screening schedule for you based on your individual risk factors. The prognosis for individuals with colonic polyps is generally good, especially if the polyps are detected and removed early. Regular screening colonoscopies and follow-up monitoring can significantly reduce the risk of developing colorectal cancer. Recent research is focusing on identifying biomarkers that can predict the risk of polyp recurrence and the likelihood of progression to cancer. Advances in endoscopic techniques are allowing for the removal of larger and more complex polyps with less invasive procedures. Researchers are also investigating the role of the gut microbiome in the development of colonic polyps and exploring potential therapeutic interventions that target the gut microbiome to prevent polyp formation. The information provided in this video is for educational purposes only and should not be considered medical advice. Please consult with your healthcare provider for personalized recommendations and treatment options.